Hello and welcome to the special program on diseases and cure. This is DN Srivastava and you are watching the DN News. We welcome you all to this special talk with Dr. DK Satsangi, an eminent cardiac surgeon on bypass heart surgery, angioplasty. Dr. Satsangi, a senior cardiac surgeon, had retired as director professor GB Pant Institute of Postgraduate Medical Education and Research, New Delhi, and had also been heading the Department of Cardio, Thoracic and Vascular Sciences at All India Institute of Medical Sciences, AIMS, Rishikesh in Uttarakhand. To once again remind you, Dr. DK Satsangi has undertaken almost about 25,000 open heart surgeries and is a specialist in coronary artery diseases and has been in the management of heart complications of all types. He has successfully undertaken 25,000 open heart surgery with a meager number of mortality. Dr. Satsangi is a well-known personality for his life-saving skills in management of chronic heart ailments. We are all extremely fortunate to be with him on this talk show every week, despite his tremendous busy schedule. Last week, we discussed about the causes, prevention, management, and treatment of heart attack. Today, we shall talk about intervention in a case of coronary artery diseases like angioplasty and coronary artery bypass grafting, the CABG, what is coronary. And now I would like to request Dr. Satsangi to please join this show. We welcome him onto this show, and we would first like him to explain what exactly is a coronary artery bypass surgery and angioplasty. What is angioplasty? I would first like to know about this.
Thank you very much, Devenji. Thank you very much for inviting me on such a vital discussion on coronary heart disease. As we talked last time, that coronary artery disease are one of the most important diseases of the heart. And we discussed that in coronary artery disease, the coronary arteries, which are the main blood supply to the heart muscles, are blocked either by fatty material, to which we call as atheroma, or by a blood clot. Now, when we talk of angioplasty, angioplasty is the procedure to open these blocked coronary artery by using a balloon catheter. What do we mean by catheter? Catheters are the tubes, a very tiny tube. It has got a hole inside, and at the tip of the catheter, there is a balloon. So this catheter is introduced into the body through an artery, which is known as femoral artery, or through the artery of the hand, which is known as the brachial artery or radial artery, and then it is guided intravascularly, meaning thereby inside the vessel only, into the aorta, which is the major artery arising from the left ventricle. As we have seen yesterday, from the aorta, the two coronary arteries, the very first branches of the aorta which supply blood to the heart muscle is arising. Now this catheter is introduced into the opening of the coronary artery, which is known as the coronary ostium. And then it is slowly guided into the course of coronary artery up to the end where it is blocked. When we come to the block, then we negotiate this catheter through the block in the coronary artery, and then we place the balloon in that place. Now, by using a dye, we inflate this balloon. As this balloon is inflated, that obstruction is dilated, and coronary arteries which were blocked, they become open. But they have a tendency to get blocked again. And to prevent this collapse, we have to put a stent. A stent is like a spring which is made up of different kind of alloys. They are medically coated so a clot doesn't form, and that stent is placed in the diseased area of the coronary artery, which is just dilated with the balloon so that it does not collapse again and a re-stenosis is prevented. This is what we call as transcutaneous or percutaneous coronary angioplasty and stenting. Now, this angioplasty has, in the last 20 years, I should say, has become very popular. Before that, it was coronary artery bypass grafting, which was most popular treatment for the coronary artery disease, which often results into the heart attack.
Okay, sir. In layman's language, I would like to know what are the conditions. I mean, what is the stage, and how? What are, or we can say, what are the symptoms when we know that we should now go in for a coronary angioplasty?
Now, I will say the most common symptom of coronary artery disease or blockade in the coronary artery is known as the angina. This is the angina pectoris. Angina pectoris is the heart pain which comes on exertion and it is relieved on rest. Most commonly, if we take a tablet of sorbitrate, then the pain is relieved. This is angina pectoris, one of the common indication for coronary angioplasty. The another angina is the rest angina. Now, in this condition, the coronary arteries are so critically blocked that patient gets a pain even at the rest, and it is often relieved by taking sorbitrate and may not be relieved. If it continues in spite of taking rest, in spite of taking the sorbitrate, then it is known as unstable angina. It is the most severe form of angina, often known as the pre-infarct angina, because it results into the heart attack or the myocardial infarction, and this is a cardiac emergency and should be immediately treated by intervention. The other indication of the angioplasty in the coronary artery disease is on coronary angiography. As we discussed last time, that using the same catheter, we introduce the dye into the coronary artery and the serial films are taken, which is known as cineangiography. And this shows the course of coronary artery into its entirety, and we know what is the block, where is the block, how many blocks are there, and then what is the degree of blockage. And once knowing that, we know about the anatomy of coronary artery disease, then we can plan our coronary intervention. Usually, if an artery is blocked more than 70%, then we take it for coronary angioplasty. If there are more than two coronary arteries are blocked and they are more than 75%, then we take it for coronary angioplasty and stenting. The other common conditions of the coronary angioplasty are the complication of the heart attack. Sometimes patient may come into early stage of heart attack, and if reaches the hospital in time and a coronary angiography shows that there is a critical obstruction in coronary artery, that is an indication for the coronary angioplasty. If there are complications of the heart attacks, like if patient is having mitral regurgitation, that is one of the important heart valve has become incompetent because of the heart attack, or there is a ventricular septal defect, that a portion of ventricular septum is dissolved because of the heart attack. So in these conditions, which are the critical conditions. Another critical condition is known as the cardiogenic shock. As the name suggests, that patient is in a state of shock, is in a state of collapse with low blood pressure, with high pulse rate, with decreased urine output and breathlessness. This is known as cardiogenic shock. If this condition is not treated, patient often proceeds to the fatality and he may die. Therefore, in these conditions also, a coronary angiography and a coronary angioplasty becomes a certainty and it is urgent.
Okay, sir, if I want to know as a layman, is it possible to go undergo for the test and uh, checkups by remaining at home, or is it important and necessary to get admitted in the hospital?
See, most of the cases here, patient have to go to a center which has got all these facilities. As we discussed last time, the primary investigations will be on ECG. ECG facilities can be taken to the patient's residence also. A doctor can go with an ECG machine and record the ECG in emergency. The other investigation is an X-ray chest. For that, most of the time, patient has to go to a clinic or have to go to hospital to get X-ray chest done. Then another investigation is a 2D echocardiography. This tells us most about the cardiac conditions, and usually the patient has to go to a heart center or to a hospital where these facilities are available. Nowadays, we have portable 2D echo machines also, and if a clinician, a practitioner has the facility, he can take these machines to patient's home and record 2D echocardiography. But most of the time, patient is required to reach to hospital to undertake advanced car investigations like 2D echocardiography, a coronary angiography, or a non-invasive coronary angiography, which are the final court of appeal and leads us to the final diagnosis.
Okay. Now, if I ask you, what is the time that you take for an angioplasty in a patient? Is it a day within the same day he is taken for angioplasty and he is relieved also from the hospital, or he has to stay for a certain time in the hospital?
Angioplasty is a very safe procedure, number one. And number two, it is carried out in a short time. Most of the time, patient takes half an hour or it will take 1 hour if there are more than one arteries to be stented. And they can be done on a daycare basis. Some of the hospital perform the angioplasty in the morning and may discharge the patient in the evening or night, or you may keep the patient for overnight and then discharge next morning. Patient doesn't require very long admission in the hospital.
That's great. And what are the results of these coronary angioplasty? If I ask you the fixing of the stent into the arteries and these things, what are the results? How much is it successful in today's life?
I would say the results of coronary angioplasty and stenting are excellent. They are very gratifying. Most of the patients are relieved of their symptoms, that is angina pectoris, and in most of the cases, the impending heart attack is reverted. In the cases of emergency angioplasty, where there is an impending infarction, if it is successfully done, the patient's life is salvaged. So, by and large, I would say in today's time, the coronary angioplasty have a very good results. They are very gratifying, and patient should not refuse if he is offered a coronary angioplasty.
Is there any after effect or complications after the coronary angioplasty or fixing of the stents?
There are certain complications during coronary angioplasty. There are immediate complications of coronary angioplasty, and then there are later complications of coronary angioplasty. I would say that during coronary angioplasty, A coronary artery may rupture or it may get perforated, and this will lead to cardiac tamponade. That is, lot of blood coming out from the coronary arteries will collect around the heart and will produce a fatal condition which may have to be helped surgically. Then the another acute complication is the dissection of coronary artery. When you are trying to negotiate the catheter through the diseased area of coronary artery, it may cause dissection of the layer of coronary artery, and coronary artery, which was partially occluded to begin with, may get completely occluded, leading to the coronary infarction. In such conditions, we may have to put a stent there in order to restore the lumen or patency of coronary artery. Sometimes it may cause a crash, what we call as PTCA crash, and will require a surgeon to perform an emergency coronary artery bypass surgery in order to salvage the life of the patients. So these are the acute complication. Then there may be late complications, which may be restenosis of the coronary angioplasty. Whatever reason has been dilated, this may become stenosed again, and the symptoms will return. Sometimes the stents also may get blocked after coronary angioplasty, and this may require the repeat coronary angioplasty or a coronary artery bypass surgery.
Okay. And if one wants to have this coronary angioplasty, can you suggest some of the centers in Delhi and across the country, some major centers where they could go and have this surgery done, this angioplasty done?
Delhi have got a number of the coronary artery interventions centers. If you want me to name, there are many centers, government centers, which are doing coronary angioplasty successfully with very good results for a very long time. One is definitely All India Institute of Medical Sciences, who are performing plenty of such procedures. Then we have GB Pant Hospital now, which is now has become GB Pant Institute of Postgraduate Medical Education and Research Center. This is also performing a large number of coronary angioplasty successfully for quite a long time. Then we have the Safdarjung Hospital in Delhi, which is performing coronary angioplasty. And then some other new centers also have come, like Rajiv Gandhi Center, which is associated with the GTB hospital. They are performing the coronary angioplasties. If we talk of the private centers, then we have, of course, Medanta has a big name. They are doing plenty of coronary angioplasty with good results for a long time. We have the Indraprastha Apollo Hospital. We have the Escort Hospital, which is the Fortis Hospital at Okhla. And then we have the Max Hospital in Saket. And we also have the another Max Hospital, which is close to it, is the in the Saket itself. And so Fortis Hospital in Noida, Fortis Hospital in Gurgaon. So there are many centers, I would say, and all of them are doing very good job, and they can be easily and successfully perform coronary intervention. So patient should not hesitate that he has to go only one particular center. Most of the centers are doing good job.
That's great, sir. Now, I would like to also know what is the cost involved in this kind of an angioplasty?
Cost of the coronary stents at a time used to be very high. And I remember when it was introduced, the cost of a coronary stent used to be about 1 lakh rupees. And this is usually then 1.5 lakh rupees only for putting the coronary stent. So it used to be about 2.5 lakhs for one stent or 3.5 lakh for two stents. But government has taken a good step, and the cost of coronary stents had drastically come down. The one coronary stent nowadays is costing something between 15,000 to 25,000. And there are many types of stents. There are some drug-eluted stents, Now, drug coated stents, they are a little more expensive. The non-drug eluted stents are less expensive. But I would say a patient can get a coronary angioplasty for one or two vessels, something in between 1 lakh to 1.5 lakh. Some big centers may be charging little more because they have got big reputation. So that is also there.
But if I say the total cost would even then cost more than 50,000 rupees for one stunt, I think, if I'm not wrong.
I don't know exactly, but it should not be because government has put a restriction on the rate of these stents, and maybe some very sophisticated stents, which are drug coated and which have been recently introduced with certain benefits, maybe charging more. And you may be right; they may be costing 50,000 or maybe less or little more.
And you have been in the government for the last many years, and if I ask you what kind of treatment with respect to the coronary angioplasty is being provided to the poor patients who are below the poverty line, what about them, and what kind of percentage you have noticed in a BPL or a below poverty line patient and other patients? Is it somewhat less number of heart patients in those category?
Yes, that's very right. Government was very supportive to these patients, poor patients who were holding a BPL card. They are the BPL patients, and there used to be certain other yojnas also. And if they had those cards, government used to provide them the free treatment, free angioplasty, free coronary artery bypass surgery, free heart valve surgery, and then there was also provision that those patients who had some kind of support like from ESI or support from CGHS or support from nowadays from the Ayushman card holders, all these treatments and the cost of treatment is borne by the hospital. And it's a good news because not only government hospital, even the private hospitals are providing free treatment to those patients who are holding the Ayushman card or CGHS card or ESI card or those who are below poverty line.
Okay, this was about the coronary angioplasty that we have been discussing so far. Now, if I talk about coronary artery bypass surgery, what what exactly is the difference between coronary artery angioplasty and coronary artery bypass surgery? What exactly is the difference between the two?
Coronary angioplasty, as I said, that here a cardiologist tries to open the block of coronary artery, which is causing the symptoms and causing the threat for the heart attack. Coronary artery bypass surgery, which was introduced in 1964. So I would rather say almost 60 years from now or less than that. And this is involved, as the name suggests, is bypassing the graft. So what you do, you take another tube. Usually it used to be a saphenous vein from the leg of the patients. And then you join this vein, the coronary arteries, before the site of obstruction and then the ahead after the obstruction. So what happens that this obstruction is bypassed and blood flows freely from the coronary artery to the distal area that is beyond this obstruction and supply to the heart muscles which were earlier being supplied by the coronary artery. So this is what is known as the coronary artery bypass surgery. Now later on, some other conduits were also used, which we'll discuss later on, like taking the internal mammary artery, the epigastric artery, the radial artery, umbilical artery. So all these arteries are also being used for bypassing this coronary obstruction. Now, as this name suggests, the coronary artery bypass surgery involves the opening the patient's heart. So it's an open heart surgery You open the patient's chest and then you expose the heart. And after exposing the heart, you put the patient on bypass. This is the earlier practice which I am saying. So you put the patients on cardiopulmonary bypass. You stop the heart with cardioplegia, and you have already taken or harvested a saphenous vein from patient's leg, and then you do perform this anastomosis, one to the aorta, which is the major artery, and the other to the coronary arteries. And then, as I said later on, the internal mammary artery, the epigastric artery, umbilical arteries, radial arteries, these all arteries have been used to for this purpose. The another development which has taken place is the off-pump surgery, which is the coronary bypass grafting is performed on beating hearts. So in these conditions, you don't have to stop the heart. You don't have to use a heart-lung machine. And while the heart is beating, you have got certain the coronary stabilizers with which you stabilize the coronary artery, and then you perform this bypass of procedure.
Okay. Sir, now I would like to know what is the stage of a coronary artery bypass surgery? Is it that there is a stage when you cannot do without a bypass surgery, and you should not go in for a coronary angioplasty? Is it something like that, or you should first try coronary angioplasty and then go for bypass?
Both ways it is correct. Earlier when there was no angioplasty, most of the indication of coronary angioplasty, which I have discussed earlier, they were the indications for coronary artery bypass surgery. Like if patient is having angina pectoris, if patient is having unstable angina, if patient is having pre-infarct angina, patient is having rest angina, patient who suffer from the complications of heart attacks like cardiogenic shock, the acute mitral incompetence of ischemic origin, ischemic VSDs, ischemic aneurysm of the heart, cardiogenic shock. So all these were the indication for the coronary artery bypass surgery. Now when angioplasty has come, because this involved lesser stay of the patient in the hospital, and also this was more preferred by the patient because he is very happy that he can avoid a major surgery, he can avoid a long stay in the hospital, and he also thinks that if you perform a very major surgery, he has more chances of having mortality or more complications, which is true also in some way. While with angioplasty, it is done in a daytime and then you can go home next day, and results are also gratifying. But there are certain conditions when you have to do coronary artery bypass surgery. Number one is when there is a failed angioplasty. Cardiologists have tried to open the block and he could not open it. Therefore, there is no other alternative but to perform a coronary artery bypass surgery. Number two, if arteries are so critically blocked and there are multiple blockage which cannot be opened with coronary angioplasty, then they go for coronary artery bypass surgery, and all these arteries can be grafted at the same time. So this is another indication for coronary artery bypass surgery. Number three, as you discussed just now, that the complication of coronary angioplasty, like if there is a perforated coronary artery, if there is a dissected coronary artery, if there is a PTCA crash, now in these conditions, you may have to perform a coronary artery bypass surgery. So if there is multivessel disease, number one, if there is a disease of left main coronary artery, which was very risky for doing an angioplasty earlier, I must say. But now people are performing coronary angioplasty even of the left main coronary artery successfully. Sometimes if a coronary artery is ulcerated, Now, if you try to do an angioplasty, there are more chances that it may get dissected, and this may be completely occluded, leading to the fatal complications. So, in all these conditions, you perform the coronary artery bypass surgery. Sometimes, if coronary artery disease is associated with other complications, like apart from coronary artery disease, you have a imperfect heart valve which is not normal, which requires to be changed, or if there is a ventricular septal defect, or if there is other associated conditions which need operation like an aneurysm of the heart. So it will be preferable to do a bypass surgery when you undertake these patients for correction of these heart defects. So these are the many indications for coronary artery bypass surgery. Sometimes some people prefer coronary artery bypass surgery to coronary angioplasty because they believe that long-term results of coronary artery bypass surgery are more gratifying than coronary angioplasty. But I would rather say that this is a matter of discussion, and people discuss it on the merit of the patient.
Okay. Now, I would like to know that what kind of grafts are used in bypass surgery, because as you said, you are taking arteries from the legs, umbilical cord, and other parts of the body. Is it something like stunts being sold in the market? Are these kinds of bypass grafts are also sold in the market, or you have to take it only from the human body?
Now, I would not say that they are being sold. But as I said earlier, when this CABG or the coronary artery bypass graft started, it was usually the saphenous vein, the long saphenous vein from the leg which was harvested. And this was used as a conduit for bypassing the coronary artery. But later on, studies showed that they didn't have a very long term patency. And most of these grafts used to get blocked in 5 to 7 years of time. I would not say that all of them. Some of the grafts go very long. They can flow even up to 15 to 20 years. But majority of them used to get blocked and patient symptoms used to return. They start suffering from angina again. And therefore, they had to be reoperated, second operations. So there was a time when there was one surgeon by the name of Mr. Green, and he took the internal mammary artery, which is present behind the sternum of the patient in the front chest wall, very close to the heart, and he harvested these internal mammary arteries. They are very thin compared to the vein, and he anastomosed it to the coronary artery. And then he thought that they might have got blocked because the artery was so small. But later on, when these patients were investigated almost 10 to 15 years after their surgery, the doctors were very shocked to find that all these arteries have grown big in size and they are providing a major supply to the heart muscles. So they found that this was a very good substitute to the saphenous vein of the patient, and therefore more and more surgeons started opting for arterial grafts, which was the most cases internal mammary artery, usually the left internal mammary artery. Then people went for the bilateral internal mammary artery. Then people started talking about the total arterial revascularization of the heart. That is, you graft all the blocked coronary arteries with the arteries only. So you can use internal mammary artery, you can use the right internal mammary artery, left internal mammary artery, or both mammary arteries. You can use the epigastric artery, you can use radial artery, you can use splenic artery. So all these procedures were performed, and it was found that a total arterial revascularization is a better option for coronary artery bypass surgery, because in most of the cases you can talk of a long-term patency of 20 years or more. So patient avoids the second operation at least for more than 15 to 20 years. So these are the usual conduits which are used for coronary artery bypass surgery. And today's trend is that at least one artery should be used, preferably internal mammary artery, a left internal mammary artery, and other arteries may be grafted with saphenous vein.
Okay. So, if I ask you that if this kind of artery parts can be used as stunts, is it possible, or you have to buy only from the market?
No, the arteries are in the patient only. They are not to be bought from the
No,
market.
for the purpose of angioplasty, I'm asking you, if you put a stunt buying from the market, is it possible to use the parts, smaller parts of the arteries that you use for bypass and use it for in the angioplasty? Is it possible to do that, or you have to buy a stunt from the market only?
No, yes, the two are totally different, you know. The stent is an part of angioplasty, and you put it inside the coronary artery. Yes, but when if a stent is blocked and it cannot be reopened, then coronary artery bypass surgery has to be performed, you know, to bypass that obstruction. Yes, and sometimes, as you said, that when you have performed a coronary artery bypass grafting, your graft may also get blocked. As I said earlier, usually it's saphenous vein, they get blocked. Sometimes even arteries also get blocked. So they can be opened with a stent, you know, you can perform an angioplasty, and where your stent is obstructed or it is blocked, it can be opened with angioplasty, or even a stent can be put there to make it patent.
Okay. And we are in short of time, so few quick questions. What are the results of this bypass surgery?
Results of bypass surgery had been very gratifying, I would say. And from very beginning, as I said, the first bypass was performed in 1964, and after that, the almost I would say 70s, more than 70 years have gone, and millions of operations are being done all over the world. And as I said, the arteries, the arterial grafts have a very long-term patency results. The mortality in selected or elective cases where there is no complication is less than 1% in good center, or 2 to 3% in average center. If you are performing in high risk patients, you know, elderly patients with poor heart functions, in diabetic patients, in the patients where you are doing second coronary artery bypass surgery or third bypass surgery, even there, you know, the mortality rate is in the range of 5 to 10%. If you are doing it for a highly complicated cases where the patient is in heart failure or where the patient is having cardiogenic shock, then mortality is high, definitely 30% or maybe more. So I would say by and large, the immediate mortality is not very high and it's very gratifying. The late result for the blockade of this, almost 90%, the stent remains patent for 15 to 20 years. So patient is, you know, is granted a life of 10 to 15 years. There is no further heart attack. There is no further angina. There is no further arrhythmias. And quality of life also improves because patient becomes very active. He can do his job properly. He can play games also. He's not restricted. So results, I would say, are quite good. You know, the picture is very rosy with coronary artery bypass surgery. And one more thing I would like to add that this angioplasty and bypass surgery, they are not opponents. They are not opposing to each other. Rather, they are more complementary and supplementary to it. And it is for the surgeons and for the physicians, you know, to decide what is the treatment best suited to the patient as per the merit of the patient. If he thinks that surgery will be better, that he should not try to do unnecessary angioplasty. And if he thinks the angioplasty is enough to salvage the condition, then they should not push the patient for surgery. So it is all, you know, a very using all this angioplasty, stent, and coronary artery bypass surgery, which is available to us today, very judiciously and very impartially. It is not the surgeon should say that you should do take only bypass surgery, and the cardiologist say no, bypass is not necessary. I will correct it with angioplasty. So this has a very important decision. They should think in terms of patients, you know, benefits.
Yes, but that again depends upon the commercialization of the whole thing. If the private doctor thinks that he has to make more money, then he will rather suggest for bypass surgery and not an angioplasty. So those things are also have to be considered. But anyway, I would like to ask you some small questions. Immediate and long-term effects of the bypass surgery. Is there any?
Yes, immediate and long-term effects, as I said, they are very, very good and they are very beneficial to the patient. The immediate mortality is less. Patient symptoms are relieved immediately. Patient's lifestyle improves. Patient's these complications which are impending due to the obstruction of the coronary arteries, that is also deferred. So good results, I should say, by any means, and long-term results are also good, particularly coming up with the arterial revascularization of pump bypass surgery, where the patient's stay in the hospital is less, the complications are less, and even I should say the cost is also less because all this heart lung machine and its disposables are not required. So it is by and large, the coronary artery bypass surgery is welcoming.
What could be the cost of an bypass surgery if I want to know as a layman? Just
Bypass surgery is
approximately.
varying now. When it started in my time in private setup, though we used to do it all free, and government hospital used to provide the free coronary artery bypass surgery. When these private hospitals came, they used to charge, something like 3 to 4 lakhs or even 5 lakhs. Some big hospital 5 to 6 lakhs. But then because of the competition, it came down, and most of the hospitals are now today offering it from 2 lakhs to 2.5 lakhs. Government has further reduced the cost of bypass surgery, and they sanction only 1 lakh rupees, in Ayushman and all that. And within that money, most of the hospital have to perform these operation. CGHS gives about 1.4 lakh. ESI also gives about 1.4 lakhs for CABG surgery. So this is the state of affairs. But if you go to the other part of country, like if you go to Bombay, they still charge very high. I don't think any hospital is charging less than 5 lakh rupees for a coronary artery bypass surgery. So it depends, which hospital you have gone. They have different, cost of the surgery, which is, I would say, rather varying from 1.5 to 5.5 or 1.5 to 6 lakhs per patients.
Okay, so this is the last question to end with. I would just like to know if there are any complications of bypass surgery and what exactly is the failure rate in a bypass surgery.
Failure rates are not very high. As I said, if you are doing an elective operation where the heart function is good and coronary arteries are, good size, if the patient is not diabetic, if patient is not hypertensive, if patient is not in heart failure, I would say that complications rates are very less. But in case there are some associated factors like diabetes, patient is having hypertension, patient is having poor heart function, patient is in heart failure, then definitely the risk of surgery is high. The immediate mortality may range from 5% to even 10 to 15%. Then there are certain surgical complications also. Patients may have profuse bleeding after surgery. That's important. A graft after surgery may get acutely blocked, so patient has to be reoperated after surgery. So these are the complications, of course, and they are associated with any other surgery. So I would not say that these patient is free of these complications. Late complications, I said that some graft may get blocked and symptoms may return because of the blocked graft. Patient may start having angina. Patient may suffer from heart attack. Patient may suffer from cardiac arrhythmia. Patient may suffer from heart failure, poor LV functions, LV dysfunction. These are, of course, the late complications which are associated with coronary artery bypass surgery.
But in any way manageable.
Of course, manageables. Most of them are manageable. And depends, if there are serious complications, they involve higher risk. If there are the usual complication, minor complication, they involve, less risk. So this is all in the part of the game.
So these were a very important information, very valuable information that has been provided by Dr. D.K. Satsangi, an eminent cardiac surgeon of this country. And I know many of the people are suffering from heart diseases, heart ailments, and most of them are prone to have these kinds of operations, surgery also, like the angioplasty and the bypass surgery. But there's no need of any worry. There is no need to panic. There is no need to have any kind of doubts in the mind, because the medical science in India has come up to that stage that you can get rid of all your heart ailments with these kinds of information that Dr. Satsangi has given you. I don't think anybody would have any fear in his mind because of the heart ailments. And it's really nice talking to you, Dr. D.K. Satsangi.
Thank you very much, sir.
A very precious information that has been given by you to the people of this country. I think if this would be definitely beneficial and useful to everyone. And I would like to request all of you, if you have any queries, any questions with Dr. D.K. Satsangi on any of your heart ailments, please do not hesitate to send us your questions. You can send your questions right away on our WhatsApp number 921-129-7887 or 8800126010. You can also send your questions on our email. Our email ID is editor.exclusivepost@gmail.com, and Dr. Satsangi would definitely provide you with the right answer. You can also connect with Dr. Satsangi during the show, after the show, at the question and answer session. So he can provide answers to you right away online. So it's time to sign off now, and see you next week, same time again, with a talk with an eminent personality, with some other doctor, or maybe Dr. Satsangi, if he has the time. We would like to discuss more about heart ailments on Monday, same time. So it's time to sign off now. See you next Monday, 7 p.m. Till then, keep watching the DN News. Good night, Shubhratri, Shabba Khair.
Thank you very much, sir. Thank you.